It's the Mississippi Municipal League's annual conference. Have assembled here on the beautiful Mississippi Gulf Coast. We welcome now David Culpepper, Marketing Director, Covington County Hospital. Hey, David.
Gerard, how are you this afternoon?
I'm doing fantastic. I've got a wonderful view here of the beautiful Mississippi Gulf Coast, the Gulf of Mexico out the windows here in the lobby of the convention center. We appreciate you calling in and really appreciate you guys participating as a sponsor of our broadcast here remotely at the MML conference. Tell us about some of the expansion projects you've got going on there at Covington County Hospital.
Well, we've got a $4 million grant that was awarded by HRSA, and Senator Cindy Hyde-Smith was very instrumental in helping us gain that grant. And it's going to be, funds will be used to create a portico and covered drop-off on the front side of the hospital for patients and visitors coming in. And it will allow us to reconfigure the inside of the hospital a little bit as far as admissions, registrations, and things such as that. It'll just make the patient flow a lot better, a lot easier for patients to navigate, and for patients to, for family members and visitors to navigate the hospital and just that process. And it's, you don't want to get stuck in a flow with the waiting area and start backtracking. So we're going to try and lay this workflow out to where when the patient comes in, they progress through the process and they feel like they're progressing quickly, and hopefully it will be an improvement to not only the patient care, but the patient experience as well.
Gotcha. So what about any sort of expansion, David, of just the services provided by the hospital, such as in the area of behavioral health or any sort of outpatient or inpatient services? Is that on the board, something you guys are working on now?
It is. We currently have a BHU unit, which is behavioral health unit, for those that are 55 and above. It's inpatient. We also have an IOP program, which is intensive outpatient, which is for those same age group that doesn't necessarily need inpatient care, but they can do the outpatient care. It's a daily program that they come to, and we've had a lot of success with that, and a lot of family members have cheered us on because of the success and what we've been able to achieve there with the patients at the IOP. Transportation is also provided with that if you want it. We also have a mental health clinic that's opened up, Covington Place, that provides counseling and therapy for children ages 6 and up to all adults.
David, in general, how large is the geographic area that the hospital serves?
We're pulling probably Covington County, Lamar County, a little bit into Forest, but, we're pulling in from Smith County, Simpson County, pretty much anything that neighbors us, Jeff Davis County, we're able to pull those patients in and provide services for those patients.
How important, David, is it to have a facility that offers the scope of services that Covington County Hospital does, located in an area that's not necessarily in one of the larger metropolitan urban area, that's somewhat rural?
Yeah, it is, and we're what you consider the poster child for rural hospitals in the state of Mississippi.
Okay.
We're kind of sandwiched in between Jackson and Hattiesburg and the bigger cities that have the more services. Obviously, we're a critical access hospital. We're not going to deliver babies. We're not going to do general surgery, but what we can do is offer some subspecialties through our outpatient specialty clinic, which starting, I think, July 5th, Dr. Singh from South Central Medical Center, an oncologist, he'll be coming over doing clinics every Friday starting in July. So we're excited about that. And that is some ways how we can expand some services, Gerard, is getting those subspecialty providers to come down and do clinic once or twice a month to do clinic. And then it saves the patients from having to do their follow-up visits, drive for an hour, hour and a half. Obviously, procedures and things like that may need to go back to their main office, but we're working diligently and communicating with our community to find out what services are needed. What does healthcare look like for us as a critical access hospital 3 to 5 years down the road?
Yeah. I just wonder if Covington County Hospital did not exist where it does, what would these patients do? Would they be forced to travel longer distances to Jackson, Gulfport, Hattiesburg, for example?
Yes, they would. And, whenever you start looking at those hospitals not existing in those communities, 30 minutes could mean saving a life. If you're having to drive an extra 30 minutes with a cardiac patient or someone who's having a stroke or maybe someone's been in a terrible accident, that 30 minutes could mean the difference between life and death. And it's, we do a really good job here with getting those situations treated, getting them stabilized and transferred to a facility that specializes in whatever that particular patient's needs is.
Gotcha.
And we're
Gotcha.
we're really good about getting that done.
Dave, appreciate you joining us. And again, thanks for your sponsorship of our broadcast today for the Mississippi Municipal League's annual conference. We'll talk to you again at the end of the next hour.
All right. Sounds good, Gerard. Appreciate it.
Thank you, sir. All right, folks, it's time for Fox News and SuperTalk News. It's top of the pleased to welcome again David Culpepper, Marketing Director of Covington County Hospital. Hey, David.
Good afternoon, Gerard. How are you?
Doing fantastic. So appreciate your insight in the previous segment about the hospital and its expansion plans, services it provides to the local communities there. What are some of the challenges, David, that the hospital is currently facing that you guys are working on?
As always, it's utilization, making sure
Yeah.
people are using the services. And that's hard to do, is to make people use something. But that's an obstacle that's there. But, just continue to find ways to be innovative and forward thinking, trying to figure out where we need to be in 3 years, where for the past couple of years during the pandemic, healthcare was basically reactionary and there was no proactive thinking there. You're just trying to face what comes down the pipe at you that day. But now we're out of that mode. And we want to look at what's out there 3 years down the road, 5 years down the road. Where do we need to be? What does our community expect of us, and how can we meet those needs? And that, to me, that's the biggest obstacle that's in the way, is taking all that information and finding the gold nuggets in it.
What do you think we can do, David, to get our population to seek regular wellness checks and the various screenings that can catch illness and disease before they advance to a more serious level? So much could be avoided just from a health outcome perspective and, of course, a financial perspective. What can we do to improve on that?
I think community education is the first step we've got to take as healthcare providers, is educate the community on why it's important to do it. I know for myself and a lot of others, if you tell me why I need to do something and show me why I need to do something, I'm more apt to do it and remember to do it versus you telling me to do it. I might not respond as positively, but I think really education, and I think it starts in the schools of educating the kids of, proper diet, exercise, those type things. That there's a lot of things you may have because it's hereditary, but there's some things you can do to control if you've got diabetes or if you've got hypertension or some other chronic illness that you're dealing with. There's ways to control that and live a full life with it. And I think that starts there early.
You talked about just how healthcare has changed somewhat pre-pandemic to post-pandemic. More of a reactive and I guess shifting back more to proactive, right, after the pandemic. What else has changed? I mean, from what I hear from folks in the healthcare industry, the economics of healthcare has changed dramatically since before the pandemic to post-pandemic.
Oh, yeah. The cost of goods, just the cost of doing business daily is probably tripled of what it was 2.5, 3 years ago.
Yeah.
The salaries have gotten, but you got to have the people to take care of the patients. And so you got to pay the salaries at some point. But there's and I've always asked this question since it started, is where's the ceiling? At what point do you cut this thing off and say, we can't sustain this? And healthcare as a whole, there's some things in there that you can't get around, but there's some ways to curb some cost by using different personnel to do different jobs. But at the end of the day, you still got to have your RNs, and that's you know this as a business person. Your biggest overhead is salaries.
Right, absolutely. So, David, it's Covington County Hospital. Have you guys recovered from what were just acute staffing shortages during the pandemic, and just lots of chaos with labor, honestly. Lots of folks signing up to be part of these traveling consulting organizations. Have you kind of stabilized and returned to sort of pre-pandemic normal?
We have, and be honest, we really didn't lose a whole lot to the travel side during the pandemic in Covington. But the one thing that we did lose was employees retiring. We lost employees due to illness, and people were out various different periods for being ill. But we faced the same issues that everybody else did, just maybe not at the same level. But we've kind of returned back, and I think most of all, healthcare as a whole has returned back to where it was pre-pandemic. So, other than the elevated salaries, but those things, hey, if you ask it and they pay it, go take it.
Well, we appreciate your sponsorship for our broadcast here at the Mississippi Municipal League Conference. Really appreciate that, David. Always good to see you and talk to you.
Good to see you, and I appreciate you guys being willing to do the broadcast down there. So thank you.
Absolutely. All right, folks, that's a wrap here from the Mississippi Coast Convention Center. The Mississippi Municipal League Conference will continue today and into tomorrow.